Welcome to Coping with COVID-19. I'm Dr. Allie Sharma. This is an interview series and safe space to collectively cope and share our stories through the COVID-19 pandemic. Quick disclaimer, please note that this interview series is for informational purposes only and it's not considered medical advice. Please consult your own provider for any issues you may be facing, and if you are in crisis, please call 911 or your local emergency services. Today, I'm joined by Francesca Marini, who works as a doula and focuses on mind-body fertility, pregnancy and doula care in New York City. Francesca first discovered the power of mind-body connection through yoga after spine surgery as a teen, which influenced her search for effective care with reproductive health issues. This search brought her to the study of nutrition, herbal medicine, and energy work, and ultimately to graduate studies in integrative health. Doula work came to her as a natural complement to her master's program. She initially signed up for doula training as a way to learn more about birth culture and supporting pregnancy, but after attending her first birth, knew that it was a perfect blend of all of her interests and skills. Francesca earned a master's degree in Integrative Health Studies with certification in guided imagery and wellness coaching at the California Institute of Integral Studies in 2015. She is a certified prenatal and postnatal yoga teacher, Reiki practitioner, and a certified Cornerstone labor and postpartum doula. Francesca's goal is to offer a calm, unbiased presence and to facilitate positive reproductive experiences by connecting people to practical, evidence-based information as well as their own inner wisdom. I am bringing on Francesca to join me now. Hi, Francesca. Thank you so much for joining me on Coping with COVID-19.
Thank you so much for having me. Really happy to be here.
That's nice to meet you this way. So, before we get into COVID-19 pandemic, I'd love for you to describe your work as a doula and what you usually do pre-pandemic, just for people who may not know.
Sure. So I work with a doula partner, and pre-pandemic, we would offer prenatal care in person. So we would meet with families, help them understand birth preferences, kind of all of the options they could make for their care. We would review with them in person ways for comfort and coping. And then kind of the foundation, I think, of the care, most people, if they know what a doula is the continuous labor support. And so we would join them most likely at their home while they were in labor and be with them until the birth of their baby. And then usually a little bit after, so we could help with initial breastfeeding and just kind of get them settled in. And then we would come in a few days after they got home from the hospital, if they gave birth in the hospital, and help with postpartum tasks. So definitely a lot of support around breastfeeding, if that was something that they were doing, but also just practical things that as a new parent are difficult, like feeding yourself and tidying and, having time to go take a shower or whatever it may be. So lots of practical support in addition to like the emotional support and information around just all of these things that seem so wild are totally normal. Or talk to your pediatrician about that, or just fine-tuning with breastfeeding.
Okay. And look, clearly you are involved in the most intimate part of the childbirth process. And so I'm curious how your work has been impacted by COVID-19 and what you've been doing as the pandemic set in.
Yes. So when we all went into shelter in place, and then when most hospitals shifted their policy to only have partners or not partners, we had to very quickly kind of scramble to figure out how we can still offer the essence of our foundation, the foundation, I should say, of our care, which is, we want to make sure people are getting all their questions answered and really know their options. We want people to feel calm and comfortable, and just confident in their decisions. So how to kind of transfer that into a platform where we're not physically in the room and we're not necessarily picking up on cues in the same way. We're not able to kind of just dive in and apply hands-on support but rather talking partners through it. So the way that my partner and I have adjusted is we added on additional prenatal visits to really practice guiding the partner through, okay, here's how you do a hip squeeze, kind of a crash course in being a doula, basically. These are things to look for. Don't talk to your partner if she's in the middle of a contraction. Wait until after.
You're really training, it's like a train the trainer model. You're training the partner to do what you do.
Yeah, exactly. And then for being there, we're still offering continuous care during the labor, but obviously it's so different. So, and what that looks like really depends on the needs of the family and kind of how the birth happens. So for example, recently I was, somebody's labor started really quickly. So I was on the phone with her as her husband was driving her to the hospital, and then until she got through triage and was admitted. Then we were able to switch to a video format, and we did like FaceTime while she was in the hospital. Some people prefer text check-ins or speakerphone. So we're really kind of just like, here are all of the different technologies that we're open to using, and pick your favorite.
Okay. And what have your specific fears, concerns, or anxieties have been, given that this is your livelihood and you're used to this kind of, intimate physical connection being in the room?
Yeah, I mean, certainly the livelihood fear came up really quickly, just because it was so such an overnight shift. I think we were able to address that in a way that we felt comfortable with. We also started to offer a weekly support group for all of the families that we're working with, which was such a nice way to bond with everyone, and offer something additional, and just hold space for everyone in this time. So livelihood was definitely a big fear. And then also, the worry of birth outcomes starting to worsen.
Right.
And there have been little things that have come up that we've been hearing in this transition of, kind of reverting to practices that we hadn't been hearing about in a while, like membrane sweeps without consent or conversation around them has started to come up a lot. And then also, now that doulas are technically allowed back in the hospital, there has been a lot of conversation in the doula community around, does it make sense for us to be there? There's fear certainly around, are we potential vectors? Can we get families that we're working with sick? Can we get hospital staff sick? Will we get sick? Doulas don't have hazard pay or disability or anything that, comes along with being self-employed. So
are you considered a visitor if you go in the hospital then for a birth?
They have shifted, and it's all shifting so quickly. So as of most recently, they are considering doulas as doulas again, as opposed to just support person. But, you don't work for the hospital, so it's certainly not the same in terms of like what's available to keep you safe in terms of PPE.
Okay. And do you have a regulatory body perhaps that advises you as a doula?
That's a great question. As of now, there isn't one regulatory body. It's all certification. And so there are multiple certifying organizations.
Okay, right. So you have to figure it out, sounds like, for yourself, using judgment, hospital policies, the family.
Exactly.
Yeah. So of the women and families that you've been supporting through childbirth virtually, what has it been like for you to experience it in this way?
Yeah, there's definitely been a learning curve in terms of figuring out a way to be the most useful, I would say, but it's still so powerful. I got to hear a baby being born on the phone the other day. because the video had glitched out. So we had moved to the phone, and there's still nothing like being present for that.
Right. And do you think, have you experienced a decreased demand for your services, given that it's virtual, not in person?
Yeah, there was a noticeable decrease several weeks ago. It has started to kind of trickle back in for several months in the future, but definitely all of the agencies saw pretty dramatic decreases in requests.
I can
Yeah.
imagine. And so, what are your observations pre-pandemic versus now in the time of COVID-19 pandemic, and your observations of how women and families are coping through this? Like any observations on psychological state or mental health concerns that you've seen?
Yeah, I mean, definitely. I would say because the collective pulse is so anxious, it's heightened when you're expecting and you have to go into a hospital, or I would say even more so postpartum.
Hmm.
Um, we've had a lot of conversations with people, especially if it's a first child. It's such an overwhelming time regardless of the outside climate, and to be a new parent in this climate is even all the more difficult because the support that people maybe thought that they would have in place in terms of family coming in or being able to go outside and do something by themselves every once in a while, or just kind of have any separation at all, is no longer there in the same way.
Yeah. Are you doing your postpartum visits virtually?
We are, yes.
Okay. And final question, what are tips from your perspective for pregnant women during this pandemic or postpartum women, of how to cope during this time?
Yeah, definitely find support in whatever way makes sense for you. There's amazing peer-to-peer groups, therapy, obviously. Doula support is so useful in this time. And just so you can have that collective space to, there definitely is a sense of loss, even with all of the excitement of bringing new life into the world and meeting your baby, but the experience is just so different than anyone could have anticipated. So having that time together is so useful. And then also I would say we've heard a lot kind of people feeling like their birth preferences don't matter in this climate. And I would say that, it matters even more so since it's already such a rough time to be in the hospital, doing what you need to do, kind of finding that inner mama lion or inner mama bear, however you want to relate to it, to really stand up for yourself and stand up for your family. Not to, of course, be rude to hospital staff, but to just make sure that you're having your voice heard and you're, finding your agency through this time is such a big deal.
Thank you, Francesca, so much for speaking with me on coping with COVID-19. I really appreciate your perspective.
Thank you so much for having me. Such a pleasure.
Now, let's get clinical. What we've heard from Francesca are two things. First, how her profession has materially changed during COVID-19. And second, COVID-19 plus childbirth and how that can change the experience for a mother-to-be. On the first, given that physical distancing as a doula means that she, Francesca, is not present during the birth except virtually, and her support is no longer in-home postpartum, her livelihood no doubt has been impacted. As hospitals slowly open up to allow others into the birthing suite, doulas included, the fears around adequate protection and viral transmission are real and the risks are still present. On the second, she alludes to how the layering of COVID-19 on an already life-changing and transformative experience such as childbirth can be unduly stressful for mothers-to-be and families. And I agree. If you are pregnant and have enlisted a doula for support of you and your birth plan, you may not be supported in the way that you anticipated, but the connectedness of that support can exist virtually still. And overall, it's crucial to find support in whatever ways that work for you. And finally, just know that it's stressful to be pregnant during this pandemic or to have planned trying to conceive this year, but now you are not sure given the uncertainties of the now. You are not alone. Make sure to seek support from friends, family, your OBGYN, a therapist, loved ones, and most importantly, other fellow mothers and parents who can help to bond through this difficult time with you. I'm Dr. Allie Sharma. Thank you for watching Coping with COVID-19.